In about 1 hour from now, the students of Sandy Hook Elementary will return to school for the first time since the December massacre that killed 20 of their classmates and 6 adults. Classrooms at a nearby middle school have been renovated to appear nearly identical to the classrooms at Sandy Hook, and children's paintings and drawings line the hallways. There are even snowflakes hanging in the windows made by people from around the world. Joining us now to talk about the psychological impact of returning to school is Katy Kamkar. She is a clinical psychologist from the Center for Addiction and Mental Health who specializes in trauma. Good morning to you. When you look at the lengths that have been gone to make things seem as normal as possible for both the students and the teachers, what are your thoughts? Are they doing it right?
We definitely need to expect feelings of anxiety, sadness, profound level of sadness because of all the losses involved, anger, and at the same time also fear for safety of self and also of others. So that's, I think, we need to expect those feelings among the children, the families, the parents, the teachers, essentially the community. I know that in regards to the school, yesterday they had the open day, which is a good thing in terms of providing the sense of familiarity, which really can help to also increase the sense of familiarity, help to reduce uncertainty and therefore anxiety, and also help to address any concerns and anxiety and fear. I also know that they tried to make the school very much familiar, like almost the same as the previous one.
I wondered about that. I mean, right down to crayons being in the exact spot they were that day.
Yes, it's a bit tricky because on the one hand, it can really, again, help to provide a stronger sense of familiarity, which then can help to alleviate anxiety and therefore work better towards adjustment. On the other hand, it also is a strong reminder of the tragedy and, of course, of the losses. So I think that people will experience it very differently. But I think at this time, what is very important is for really everyone to be provided with a strong sense of security, connectedness, hope, and calmness.
And does that mean talking about the incident?
Yes, if there is any need for it, definitely. So if the children, especially the children, if they need to talk about the worries, their fear, the anxiety, to be provided with that opportunity, it will be very important. At this time also is really reinforcing the ideas of safety and security is very important. The other thing is really to observe some common reactions. So right now, you know, we're talking of course, this tragic event that happened, symptoms of trauma. So, you know, typical reactions are re-experiencing symptoms of trauma. So, distressing, intrusive thoughts, images, flashbacks, or nightmares, or avoidance symptoms. So, wanting to avoid any kind of reminders of the trauma or feeling tense or developing physiological reactions following the reminders.
Do you think that the adults will have a more difficult time than the students going back?
I think the difficult time will be for everyone. And of course, the understanding of this tragic event will be very different for the children and the adults. But I think that the children will have a very difficult time, and also the adults and the parents as well. It's essentially, again, the fear for the safety of the self and the others. I think this really is reinforcing the ideas of safety and security and promoting the sense of connectedness and hope is very important for the children, but then also for the adults as well, teachers and parents.
What are some of the signs of post-traumatic stress disorder that they'll be on the lookout for in the coming days and weeks?
So as I mentioned, the re-experiencing symptoms of trauma, so intrusive thoughts, images, and flashbacks, nightmares, the avoidance symptoms of trauma, which could be the feeling emotionally detached, wanting to avoid any triggers, reminders of the trauma, or wanting to just avoid any activities that we used to enjoy before, and also the hyperarousal symptoms, so difficulty concentrating, difficulty sleeping, feeling especially moody, to sense of mood irritability, feelings of anger, and especially feeling excessively jumpy. It's kind of the sense of jumpiness, and also hypervigilance. So right now, could be with the children and the parents or the teachers. We could sense maybe the sense of hypervigilance, being constantly on guard in regards to the surroundings, again, because of the fear for safety. One thing that is important to note is that these are very common and normal reactions. So it's important not to panic in regards to those reactions. reactions. But of course, if the symptoms increase over time and they interfere with day-to-day activities and responsibilities, then it's very important to seek professional help.
And I think what you say is key. If you know it's normal, somehow that makes it a bit better. Katy Kamkar, great to see you. Thanks so much.
Thank you so much.